Well, it's another hump day. That means it's time for another G20 FOCUS edition. And this week, the G20 FOCUS team will focus on health and delving into pandemic preparedness, prevention, and, of course, response. So this, of course, will be on the SABC News channel as we bring you an in-depth look at all of the aspects of the upcoming G20 summit in South Africa. So SA Today, every Wednesday at 4:30 p.m. have that special G20 focus. And for more, we are joined by the anchor, Unathi Batyashe. Unathi, good morning. So a health focus this week.
Absolutely, Sakina. Can you believe it? 121 days to go before that G20 Leaders Summit in November. So yes, you're right. Today's segment is about health. I mean, just given how broad this topic is around health, we're going to be focusing on pandemic readiness. And this basically speaks to what you've just said, pandemic preparedness, prevention, and response. So they call it the triple P R. So our focus really comes after the fourth G20 health working groups. You'll recall, of course, in our previous conversations, we spoke about these various working groups that are held across the board. So this one was the fourth G20 health working group that happened in June. That focused a lot on what we're going to be talking about, just how countries can be ready, for the next pandemic, however that looks like. I mean, COVID-19, as you know, Sakina, showed us huge gaps, that speak to equity as well as equality. So we'll be speaking about just the outcomes of that fourth working group and the recommendations that came out of that, as well as the declarations that will then be taken to the Leaders Summit in terms of what fundamental changes we're going to be seeing around that. Interestingly, of course, this is before the fourth summit that was held in June, like I said. Already in May, ahead of that meeting, some members of the G20 had established this pandemic agreement, which is a huge deal, we're told, which is championed by the WHO, that's the World Health Organization. So we'll ask pertinent questions around just what that entails, specifically around manufacturing, how that will look like, resourcing and skill sets, specifically around health workforces. Just in South Africa, we told about how a number of critical health workers are leaving the country, for better opportunities. So we'll look at those countries, particularly the low to middle income countries, to see how they are going to be delving with these issues. You'll recall, of course, funding was a critical issue, particularly here in South Africa, when we were struggling with COVID-19. So what lessons were taken from COVID-19 and what are we going to be seeing going forward? Especially, Sakina, at a time where we're talking about universal health coverage here in South Africa, it's the NHI. I mean, what are some of the systems that we need to see before we can even start talking about those? And also looking at other issues that face South Africa, like vaccine hesitancy, as an example. So a huge topic, a lot to get through.
Certainly. And of course, looking forward to it later today, Unathi. And, such an important discussion talking about pandemic preparedness, prevention, and of course, response, given what we saw during COVID-19, vaccine apartheid and how the poorer countries were treated in that regard. So all of that, absolutely, I'm no doubt going to have to be under discussion. Thanks so much, Unathi Batyashe, anchor of G20 Focus, on what we can expect in this afternoon's edition of the G20 Focus. And that, of course, coming up at 4:30.